Every day, every single day, things are happening in the world of deals and deal makers. And there's never enough time to keep up with every company, transaction, announcement, or whatever. It's just exhausting. And we have a new product to help fix that. This is Axios Pro Deals, a new premium subscription product bringing you tailor-made insights like never before. For the last 5 years, Axios has helped deal professionals navigate the whole deal landscape with Pro Rata. With Axios Pro Deals, we're diving deeper into the industries that matter most to you. You just want stories on fintech? There's a newsletter for that. MedTech deals? We've got you covered. The future of retail? We'll guide you. With Axios Pro Deals, you're going to be getting all of this industry-specific insight and expert analysis at a level you simply can't get anywhere else. So if you're a venture capitalist, private equity investor, banker, trader, founder, executive, anyone who cares about deals, Axios Pro is what you need to help you understand what matters and why. Start your free trial today at axiospro.com.
Welcome to Axios' Innovation in Care and Costs virtual event. I'm Allison Snyder. I'm one of the managing editors here at Axios, and I'm coming to you from Arlington, Virginia. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join along on the conversation today on Twitter at Axios and the hashtag Axios Events. Over the next 30 minutes, I'll be joined by my colleague Tina Reed. We'll explore topics around healthcare innovation and cost, such as broadening access to care, drug pricing, and the development and adoption of biosimilars. Our first guest is the former HHS Deputy Secretary Eric Hargan, who's joining us from Washington, D.C. Hi there.
Hi, good to be here.
I want to start with a broad question for you, and that is, the COVID-19 pandemic, it's a novel challenge, right, for the healthcare system in the U.S. What grade would you give the healthcare system during these past 2 years?
Well, you see a lot of different parts of the healthcare system that have responded in very different ways. And, some of the things that I think we can be sort of proudest about in terms of our performance was around the areas of innovative responses to the disease, both with regard to sort of systemic responses, everyone coming together and sort of reorganizing systems on the fly and workflows on the fly. That's a systemic level. And then you see the technological innovations that happened in response to kind of the loosening of some of the restrictions and an embrace of public-private partnerships. So you see things like the telehealth explosion that happened, innovations in digital health, huge improvements, and I think permanent ones in American medicine that happened because of that. And then obviously, centrally, the innovations that came out of Operation Warp Speed, both in terms on the vaccine and on the therapeutic side. And I think on the therapeutic side, certainly, I don't think we've even seen the end of the benefits that came from the efforts that were made at that time in research community and the medical community generally. So I think that's an area where you looked at one of the major strengths of the American system, which is ability to innovate and think sort of things through anew, really was pushed to the fore and operated, I think, pretty magnificently in the pandemic. I hope we don't lose that spirit as we move forward into the next phase.
I want to come back to actually both of those, telehealth and Operation Warp Speed, but I guess another sort of broad question for you is, what do you, from your perspective, what are the biggest roadblocks to healthcare innovation in the U.S.?
I think there are a couple of things. One is, obviously, we have a concern in the U.S., obviously, around costs, and I think we have to have a stronger view of what the benefits are in innovation, and a broader, longer term view on accounting for the benefits that innovation causes and the costs that long term it takes out of the system. And I think that that's a very important thing to concentrate on. That's one of the issues. Another are, the threats that might be posed by a lowering of everyone's appreciation for what we've got. I think people don't always understand comparatively how much of both America's and the world's innovation come out of our country. And I think that that's something that it's hard to keep a global perspective on when you're inside the US, is to understand how important it is that we preserve the system that we have and even empower it to a greater degree to respond effectively. We just saw it perform fantastically. And I think for everyone to keep that front and center in their minds is important for us. And again, not just us, but everyone, is to keep that in place. All of these great innovators, the people that back them up, the people that enable it to take place, it's crucial for us to continue to advance on any number of diseases, not just the things like the pandemic, things like an infectious disease outbreak, but much more broadly.
On Operation Warp Speed, is that replicable? Do you think that's replicable in another, whether it be in another pandemic or elsewhere in infectious disease or in public health more broadly?
Well, I think that parts of it aren't. Some of the things that we were able to do are really things like making the pandemic response a priority and the number one priority. Now, you can't do more than one number one priority at a time. So that's kind of not really possible. So you can't replicate it in that way, in a continuous way, because you can only have one number one priority at a time. So some of those things were really part of an emergency. And I hope that in the future, when somebody in our country or anyone is faced with an emergency like that, that people come together the same way they did in this emergency. I mean, I think we can hope for that. People tend to become more concentrated when the circumstances require it. And they did this time too. I've never seen such cooperation between different private entities, between the private entity and private entities and the government, just a much more cooperative and less suspicious attitude than you normally see in day-to-day life. And I think that was all great. Is that something that's replicable day to day? Difficult to say, but there are certainly lessons I think that we can take out of it in terms of public-private partnership for solving discrete problems, not generally, but being able to focus when you can have a focus and have there to be a clear path to what needs to get done. I think we can replicate certain parts of it. As I say, only emergencies bring out certain kinds of cooperation. It really concentrates people. And so some of that, no, unfortunately, but that's human life. I think that's the world we live in. And I don't know that we're going to change people fundamentally in that way to enable that kind of cooperation to take place each and every day.
Can I ask you a little bit about the public health emergency for COVID? It's in the midst of changing. What does that mean for things like telehealth, waivers, reimbursements for testing, and all these other healthcare services that we've become accustomed to? They're sort of the norm for us. What does it mean for that?
I really hope that they manage the situation that we're heading towards in a very thoughtful manner that is well communicated ahead of time. Because as you point out, and that's completely correctly, we have gotten used to these things. They end by their terms legally when the emergency is over. A lot of these waivers, these additional payments, ability to reimburse in certain ways, they have to either be addressed by Congress beforehand, or we go off a cliff when the emergency ends. So either they mean to not fix the problem, in which case they better communicate to the healthcare sector exactly what's going to happen and not happen before it happens. or they're going to have to fix it. Congress has to fix it, either by kicking the can on some of these reimbursements for a few years, or changing it, modifying it permanently, so we have permanent access to some of these things that I think people have become pretty accustomed to, both in practice and both practitioners and patients, like telehealth.
Right. I just want to ask you, this is a good segue into the next question, which is hospitals are sort of the #1 driver of the cost of healthcare in this country. I mean, what does that require a policy response at this point?
Well, I mean, generally, we have to address a lot of different issues about the cost of healthcare. I mean, some of it's driven obviously by different classes of providers, whether it's hospitals, doctors, whoever, right? There's going to have to, where the spend is happening is where we're going to have to address whether or not there is bad spending. Now, a lot of the spending, which looks from the outside always to look bad, when you're in the middle of an emergency or you're being taken care of, it looks like pretty rational spending on the part of the people who are getting the care. The question is it the wrong kind of care? Is it wasteful? Does it not fix the problem in a way that we know it doesn't? Is it the best standard of care? Is it something that we should not be providing? Those are the kind of things, when we're not doing things rationally or in a reasonable manner, that you want to criticize it. But I would say the general statement that that we have to bring costs down generally or start chopping things away, we have to approach it pretty thoughtfully to make sure that people don't lose access to care that they need in the system, and that they don't lose what we've become accustomed to in the U.S. in terms of quick access to excellent medical care. So hope that was responsive. I'm not sure it was exactly responsive, but I think we have to look at it pretty holistically, not simply concentrating on hospitals or physicians or pharma companies or whomever. It's a big problem. We're all in it.
My last question for you is looking forward a bit. We've talked a lot about the pandemic. What are the most exciting health innovations in your perspective that people are working on right now?
I think that things that are a little bit hidden in the weeds that are going to be pretty transformative are things around data. Really, the information that's going to be brought forward by the price transparency requirements that we put in place, the new innovations that are going to happen in response to, I hope, the interoperability rule that's going to provide every American with all their information on their phones for free, and the level of provider interoperability that should be being allowed by the interoperability rule, and just the huge amount of data that's going to get out there and be able to be usable because of changes that happened. I think it's hopefully one of the final steps towards creating a really data-rich environment for it, and a lot of new players who are stepping forward to provide this information in a usable way by Americans. I think that a lot of the mystery around it, whether things that were solved by price transparency rules, by parts of the No Surprises Act, that hopefully are going to work, and the interoperability rule work over time to really get people more empowered about their healthcare, give them more information more quickly, and with a greater degree of specificity around what they need. And I think that's going to solve a lot of the issues. A lot of the technical issues, we've got fantastic people that have been working for decades in the space, creating new technologies to address all these issues. One of the ways that America has lagged is over using the information that's produced in our system in a good way to help people and give them more information and more transparency about what they're providing, and allow them more choices about what they're providing. And I think I guess it sounds like a dull part of healthcare, but I think the data part is where I see the most ferment and a way for there to be greater achievements more quickly, if we can grasp kind of the essence of what I think we're going to have in our hands over the next few years.
Thank you so much. And thank you for joining us today. Really appreciate it.
Sure. Happy to.
And next we have our View from the Top segment with Chris Freites.
Thanks, Allison. And thank you to our sponsor, Amgen. for making this conversation possible. And joining me now is Amgen's Vice President of U.S. Value and Access, Jen Norton. Jen, welcome to Axios.
Hi, Chris. Thanks so much for having me. It's great to be here today.
I am excited to talk with you, and I want to start by looking at the U.S. healthcare system generally. I think because there's been so much transformative change in the last decade or so, but we really see the focus on affordability and access remaining front and center. And I wonder, what's the industry doing to put patients first?
Well, at Amgen, first and foremost, our mission is to serve patients and to address some of the toughest unmet needs in terms of clinical development. But also we have a responsibility, we feel, to reduce the social and economic burden of disease on patients. So to that end, the investment in biosimilars is a key cornerstone of our strategy. We've invested more than $2 billion over 11 biosimilar candidates. And biosimilars are one of the biggest drivers that we see of transformation in the US healthcare system. In fact, in our recently launched biosimilar trend report, we find that competition from biosimilars has actually saved the US healthcare system about $21 billion over the last 6 years.
That is a huge number. And I wonder, when you look at that, what are the potential cost savings for biosimilars, and where have they really made the biggest difference so far?
Well, we've seen biosimilars launch in a variety of disease states, oncology being a major area, as well as respiratory, autoimmune, diabetes, and even more. If you look at the trajectory of biosimilars over the last 6 years, in those first years prior to 2019, the average market share of biosimilars after 3 years was at 39%. Whereas if you look at the most recent 3 years, it's actually 75%. So the momentum is most definitely building. And in fact, it's actually growing faster in the US at this point than what we saw in the same time period in the EU. The latest edition of our biosimilar trend report is finding that savings due to competition from biosimilars under the medical benefit continues to grow and actually reached about $3.2 billion just in Q2 of 2022 alone.
Wow, so a lot of cost savings there. And I think one area where people are really excited is next year seeing Humira's biosimilar entering the market. And Jen, I wonder, what impact is that going to have on patients and clinicians?
Well, we see the biosimilar availability for Humira as being a major inflection point in the US marketplace. So in 2023 alone, we're expecting that there will be at least 7 FDA-approved biosimilars coming to market in the US for adalimumab, and the potential for more launches in the coming months and years. As you probably know, this is one of the highest selling drugs in the United States. So this is a major market event. For Amgen, we're actually really excited about this because we will be bringing Amjevita to market, which is our adalimumab biosimilar, on January 31st of 2023. So we'll be the first ones to come to market in this area, and we're excited to work with stakeholders across the system to help bring familiarity with this product and with the biosimilar availability. That said, though, the pharmacy benefit is quite different from the medical benefit where we have launched biosimilars in the past. So we do know that there will be some new complexities in this marketplace, and we'll have some additional stakeholders that we'll need to work with along the way. But we're doing our best to figure out how to navigate through those complexities, and we're excited to see the potential that this really brings for patients.
Yeah, and I want to talk a little bit about those barriers, because I wonder, writ large, what are the barriers to growing the biosimilar market in the US? And importantly, what should policymakers know about fostering a competitive marketplace? How do we make sure that patients are getting the choices they need?
Well, 2023 is poised to be a pivotal year on a number of different fronts. And from a policy perspective, we think that there are a few elements that are really important for policymakers to consider. First of all, supporting the scientifically accurate educational outreach to support the proper use of biosimilars and help to build awareness and comfort across the ecosystem with biosimilars. We think it's important to look at appropriate regulatory standards that promote safety, efficacy, and again, help to strengthen that stakeholder confidence. And then we also really believe that this is a marketplace that's working. And from a policy perspective, it's important to create a landscape that actually supports competition with a level playing field and let the market do what it will. New laws, particularly with the Inflation Reduction Act that has just recently passed, is going to require some key clarification in order to not disincentivize the development of generics and biosimilars coming to market. And I think unless the law is modified further, some of the government price setting components of the IRA will likely stifle investments in this area, and we may actually see fewer biosimilars coming to market as a result of that. So I think that would actually take the country backwards from the great progress that we've made in these recent years. And we're hopeful that in rulemaking, they're able to address some of these areas that are kind of creating those headwinds.
No, I think that is always the key, a level playing field. And I wonder, as we start to look forward, you talked a little bit about the 9th edition of the Biosimilar Trends Report that Amgen recently published. I want to ask you a little bit more about it because you're looking at these trends, and I wonder, what does it tell us about the future of healthcare? Where are we headed, Jen?
Where to start with that one? Yeah, yes, absolutely. We're really excited about launching our 9th edition of the Biosimilar Trend Report. Every year, it's something that we look forward to releasing. It's a major milestone for my team as well as for the company at large. And as we see more play out in the marketplace, we actually have more to talk about each year. So we feel like the report has gotten better each year, and this year is no exception to that. So, this year we are painting a picture of the quickly expanding landscape and seeing some of the momentum, especially in these last few years that I had mentioned before. But we're also thinking about what's happening over the next few years and some of the key market changes that we see happening that will help to advance biosimilars, including expanding biosimilars into the pharmacy benefit space, having biosimilars approved in more therapeutic areas, meaning more doctors and patients have opportunity to become familiar and comfortable with their safety and efficacy. We're waiting to see the impact of additional interchangeable biosimilars in the US. And we're continuing to see the growth of real-world evidence that is helping to inform that future marketplace and, again, help key stakeholders in the system to develop that comfort level about the critical role that they can play in the system. Once again, we think that this is a piece of the sustainability, and excited to see it continue to evolve.
An exciting future ahead for biosimilars. Can't wait to see how it plays out. We will have to leave it there. We've been talking to Jen Norton. She's Amgen's Vice President of U.S. Value and Access. Jen, thank you so much for joining Axios.
Thank you, Chris. Happy to be here.
And now over to Tina Reed for your next segment.
Thanks, Chris. I'm Tina Reed, Healthcare Editor for Axios. Our final guest is Professor of Healthcare Policy and Medicine at Harvard Medical School and Beth Israel Deaconess Medical Center, Dr. Ateev Mehrotra. Welcome.
Thanks so much for having me, Tina.
I wanted to start off just thinking about this as a dinner party question. When you try to explain the state of U.S. healthcare today to a layperson, why is it costing Americans so much? What do you say?
Yeah, no, I think that the U.S. has a remarkable amount of innovation and new technologies being developed. But I think the average American, understandably, is just frustrated and I think fully agree with an overly complex healthcare system that has way too much administrative costs and, again, emphasizing the high level of complexity. It's almost impossible to navigate for many patients.
When I think about some of the biggest problems right now with U.S. healthcare, one of the things that comes to mind is the fact that so many people are dealing with medical debt. Why is that such a problem in the U.S. And how do we tackle that?
Yeah, I think the two reasons the medical debt is a huge issue in the U.S. is the first is, compared to the rest of the world, our prices for any given service, an MRI, a hospitalization, a doctor's visit, are typically much higher. And second, in general, though there are other countries that have a similar approach, but in general, we ask the Americans to pay a larger fraction of those costs out of pocket. So the combination of those two factors leads to many people, in particular those who are sick, having a lot of debt. And that in turn obviously has huge societal ramifications. In terms of how we move forward from here, I think the two paths, and that at least my work and others are focused on, is how do we decrease the prices in the US healthcare system? And secondly, I think we need to move away from our focus on deductibles in particular and high deductible health plans. I think that those have, while I understand why people have moved in that direction, at least from my perspective, they have a lot of side effects, nefarious, lead to a lot of problems. And I'm not sure that they're the right form of benefit design that we want to really focus on.
What do you think we should be focusing on?
Yeah, so I don't think we need to move to a system where everything's free. I do think that there is a value in having people pay for some small amount, and so there is some value with that. The approaches that I'm most excited about are similar to what we have with our pharmaceutical benefits and tiered plans, so that you would, as a patient, and you need to, I don't know, go see a dermatologist. You would be easily able to look through the different dermatologists in your community and see different co-payment amounts for those different dermatologists based on their relative costs and quality. And so it's easier and more transparent. What am I going to have to pay out of pocket? While currently with a deductible, it's really hard to figure that out.
So it's the idea of people actually being able to shop. And right now, it seems like people really aren't shopping for care. Is that right?
That is correct. That there has been a push towards, people have termed it consumer-directed healthcare. And the premise underlying that is pretty straightforward, that just as we shop for cars and houses, that patients would be given cost and quality information, as well as a financial incentive, and they'll use that information to choose lower cost, higher quality providers, and that would drive change in the US healthcare system. And currently, despite a lot of push towards that, we haven't seen much of a response from patients. And while there are many factors that play a role, I would say the one that jumps out to me is complexity. It is easier said than done to give someone a price for a hospitalization and expect them to be able to understand how that's going to impact their decision making.
So you're talking about, for instance, like the federal price transparency rules that require both hospitals and insurers to post their prices. That just really isn't moving the needle.
Yeah, so what we find is that when we offer those types of price transparency tools, you gave the example of the federal hospital price transparency initiative, but there's been a lot of private efforts in similar ways that people are given apps or websites, or states have generated similar information where they can go online and look to see what is the relative payment amount. Again, let's say colonoscopy, and you would be able to compare that. And again, the expectation is that people will use that information to choose their provider. And oversimplifying a bit, but we haven't seen much of a response from patients.
So I wanted to move to prescription drug prices, which has obviously been a big topic of discussion this last few years. The Inflation Reduction Act, obviously, a provision of that allows Medicare to negotiate certain drug prices. What do you expect the impact of that piece of the Inflation Reduction Act is? And what other pieces of the Inflation Reduction Act might we actually want to pay attention to?
Yeah, so in terms of, I view this as the first step, but not the full journey that we need to get to in terms of reducing drug prices. After decades of debate about the topic of Medicare negotiating prices with pharmaceutical companies, it starts to move that forward with a small number of drugs. And I think that that will be helpful to some degree. I don't expect it to have a major impact, but I do think that it at least starts to open that path, open that door, get us starting to move down that pathway of stronger negotiations to try to lower prices for pharmaceutical drugs. I think when you ask the average American, with these very high cost meds, and we talked about medical debt already, those can be often the major culprit for those. The other part that I am most excited about, though it hasn't been addressed yet, is to try to address the rebates. And this is kind of an obscure, wonky kind of thing. what's going on in the background is a lot of money transferring hands between the insurance companies and the pharmaceutical industry. And those rebates, I think, are really problematic because we don't understand the dollar sums that are flowing there. And I think it's really corrupting our current process. So I think trying to address and ideally eliminate those rebates would be helpful.
I also wanted to make sure we touch on telehealth. Obviously, that's been a big story from the pandemic. And there's been a lot of innovation in the virtual and digital care space. Is this, what impact do you think this is going to have on healthcare long term? I mean, do you think that this has been a true sea change?
Yeah, so I often say that the amount of change that I was expecting in a decade happened seemingly within a. So it has been a real sea change in moving us towards various forms of digital health. I think most Americans, the average experience has been a video visit or a phone call with their patient, with their provider. But there's a lot of other forms of digital health that really surged during the pandemic. Remote patient monitoring is one example of that, where we're seeing increases. So I think the sea change, it has been a remarkable change. Now, there's a lot of uncertainty on where we go from here. Usually things in healthcare move slowly. We slowly but surely generate information to understand what's the best way to deploy this, I don't know, new technology, a new cardiac catheterization or something. Here, changes happen really fast, and we're still playing catch up. So to try to understand what's the ideal way, should we use video visits? When do we use remote patient monitoring? What's the impact of this new change on spending? A lot of unknowns right now. And for us as a research community and the policy community to catch up, to understand how do we optimally deploy this new technology.
And what are your concerns about the eventual end of the public health emergency, which obviously has allowed a lot of this innovation to happen?
Yeah, and I'm saying we as a society, as a country, made a bunch of changes that were all built around the public health emergency. And that was great, and it made change. But now we're 2.5 years in, and there's so much built on that public health emergency declaration, and in particular in digital health. And so right now, patients, clinicians, are all anxiously waiting to see when that public health emergency eventually ends, because so much is going to change on that. And we're looking to the Congress as well as state policymakers to try to develop permanent policy. And I think that uncertainty right now is understandably very frustrating for people.
If you could make any change in US healthcare that you think would make the largest impact, what would you do?
Oh, that's a great question to try to, what would be the biggest change? I know this is going to sound very wonky but changing the way that we pay for a lot of care through the Medicare program would improve including bundled payments and such, would really, I think, have a real cascade effect throughout the US healthcare system that could really improve some of the issues we described in terms of prices and medical debt.
Well, thank you so much. It's been so much fun getting the chance to chat with you today.
Thanks so much for taking the time.
And thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information or to sign up for my Axios Vitals newsletter, visit axios.com/newsletters or visit us on the Axios app. Thank you all for joining, and we'll see you next time on axios.com.